how Apollo Hospitals is making a difference in the lives of our elders. To unveil this video, I now invite Honorable Justice Shri Krishna S. Dikshit sir and Honorable Health Minister Dr. Dinesh Gururao sir to kindly do the honors. Ladies and gentlemen, let us all join our attention to this meeting as we unveil the other program.
Long lectures are not that entertainable, said Dale Carnegie, a great American author of that How to Win Friends and Influence People. He was asked, which is your next book? He said, how to antagonize people and distance friends. And the public asked me how we will do that. By giving a long lecture. Therefore, I want to be as short as possible. Dignitaries on the dais. I feel honored that you have invited me to share the dais and to say a few words from the podium. As a judge of the High Court since last more than 7 years, and as a lawyer before my elevation for 25 years, I have seen the predicament the persons in the evening of their life are placed by the fate, less, more by those who ought to have taken care of them. Our Smritikara said, Pita rakshati kaumare, Bharta rakshati yavane, Rakshanti sthavire putra. The Smritikara was concentrating more on women. When child, father will look after. Pita rakshati kaumare. During her youth, husband looks after. Bharta rakshati yavane. Rakshanti sthavire putra. This is very important. Sthavira in Sanskrit is old days. If we live long, we are bound to become old. Nobody can escape old age unless one dies earlier during the youth itself. The greatest disadvantage of modern civilizations, which a great psychiatrist, Sigmund Freud, Carl Gustav Jung mentioned, is neglecting the old people because they cease to be productive. They are useless to us. So persons who are in the old days are being ignored, not only in any particular part of the globe, but everywhere. This is the reality. Bible says, look after your aged parents. Prophet also said, you look after your parents. And our Smritikaras, our civilizational values, they always injuncted people not only to respect old people, but to take care of them. You have seen in our scriptures where Shravanana Pitru Bhakti, Shravana, he carried father and mother, in fact on his shoulder, because they expected, both they were blind. They said, take us for pilgrimage. And he took. They were very, very thirsty. They said, Shravana, we are thirsty. Well, Papa, Mama, kindly wait here. I will fetch water from nearby. He went to a particular reservoir to fetch water. And when he was filling that pot, the sound which Dasharatha of Ramayana, Lord Rama's father, felt that some wild animal has come there. Therefore, with Shabda Vedi, he had shooted an arrow which ultimately killed Shravana. And when dying, Shravana said, even Dasharatha felt so bad. He said, I am dying. I have aged parents there. Kindly look after them. It was the duty of the patriarch, the king, to look after the aged people. The aged people have many problems. In fact, Parliament has passed the Senior Citizens Protection Act, which imposes a duty to look after aged parents. Now, I am told, in fact, I wanted to address the Honorable Minister. I wanted to tell him that the government is thinking of bringing a legislation to protect the old people. By one of the measures is to deprive children who do not look after the parents, aged parents, from inheriting the property. But this is not a good development. This is deterring. We have come to that level now. This is very, very bad. When we see the programs like this, the plans like this, the visions like this, we feel very, very happy. We feel really happy. At least something is being done. This problem is there in America also. This problem is there in America. But the level of governance, quality of governance is comparatively appreciable. There the protection takes place. But in Asian countries, generally, much more needs to be done. This is being done. Therefore, when Davda told me that I should come and I should share a few words with you people, I said I will apply for leave. I applied for leave today because today happens to be the compensatory working day for us. With all happiness I came here. I thank you so much, and really we should appreciate the organizers and Apollo. You know, always Apollo takes us to the higher level. Apollo of America, Apollo of India also. Thank you so much.
Why is Apollo today launching this geriatric care program? So if you look at the past 50 years, in India, a child who was born 50 years back and a child who was born today, the life expectancy has doubled. A child who's born today can expect to live twice as long as a child who was born 50 years back. Why has that happened? It has not happened because of medicine. It has happened because of reduction in infant mortality. We have markedly reduced infant mortality in this country. We have improved sanitation. We've improved vaccination rate. Childhood mortality has decreased. Agriculture has improved, nutrition is better. All of these has resulted in a substantial increase in that life expectancy at birth, which means that unanticipated early death has been delayed. Our elderly population is increasing in size. Morbidity, illness has now shifted to the last 2 decades of life. This phenomenon is called the compression of morbidity, which means that the last 2 decades of life are packed with illness. And therefore, it is incumbent on us that we develop mechanisms to take care of patients at the later stages of their life. Now, this is not just the same illness that happens later in life. A myocardial infarction, a pneumonia that happens in the last 2 decades of life is incredibly different from a young person having pneumonia. Our doctors have talked about frailty, decreased physiological reserve, the likelihood of developing complications in the hospital like kidney failure, delirium, and so on. So we need an entirely different specialty to take care of these patients because disease presents differently, behaves differently in the later stages of life. Secondly, there is an entirely new set of diseases that only presents in the later stages of life. Degenerative diseases of the brain, macular degeneration, joint diseases, these do not occur in younger patient populations. These are exclusively diseases of aging. And lastly, when our elderly population has an illness, the time to recovery is longer. The need for post-acute care is longer. The need for services like rehabilitation is higher. Therefore, we need a coordinated, specialized service, a geriatric program. So we are launching geriatric program because it's the right thing to do. I really want to thank the Honorable Justice Mr. Dixit. In the few minutes that I was able to spend with him, I learned that he has been instrumental in passing the law that protects health caregivers from violence in the workplace. So I would like you all first to please acknowledge. And every time he explained one of these to me, he explained that through the prism of dharma and the right thing to do. So that is a remarkable way to look at it. So we do geriatrics because it's the right thing to do. And I also want to thank the leadership of Apollo, the vision of the chairman, the leadership of Ms. Preeta Reddy, Ms. Sunita Reddy, who from the day I started in this organization has asked me, Madhu, when are we going to start geriatrics? It is their vision, the commitment to patient-centered care, keeping patients at the center of everything that we do, that allows us to do what is right for the patient. I also want to thank the team, Manish, Dr. Manish, Uday, Dr. Yatish is not here, and Kashmira, who's not just the MC, but has been instrumental in getting this program through, and the entire team at Bangalore that has worked very, very hard to bring this program to bear. So thank you all.
A complete healthcare package for the people who are the elderly and the seniors. I want to thank Apollo Hospitals for calling me for this event, and we just heard Doctor, are you a doctor also? No, sorry.
Not a medical doctor.
Okay, Dr. Preeta Reddy over here, and she's met her before, and she's an able leader and in the footsteps of her illustrious father, Dr. Pratap Reddy, and continuing the legacy and ensuring that the Apollo Hospitals, the Apollo name continues to grow and flourish and bring about many more innovative and creative ideas which will help in providing better health care to our people. Of course, Apollo Hospitals is one of the leading brands in this country in healthcare. Renowned and known all over, and I think if you go to any capital city, Delhi, Hyderabad, Chennai, Bangalore of course, and many other cities, they have their hospitals, and in many other towns also they have their hospitals. And they have pioneered many research work also, and I think cutting edge technologies which are available across the world, around the world, has been brought to India, and people of this country have been able to access that. And today it's not just the people of India, but I think from all over the world, people come to India to get themselves treated because availability of expert, renowned medical professionals and good facilities, and also at a reasonable and low cost. So I think that India is becoming a capital for healthcare, can really fully grow also by using this potential. And I think in that aspect, Apollo has really contributed to the country in providing these wonderful facilities which attracts the global people to come over here and use our facilities. So, saying those few words, I'm very happy that the Seniors First program is being launched today, and India being it's not an aging country. I think people above 60 years constitute about 10% of the population. And there is and of course this 10% is only going to increase. And by 2050, that is in another 25 years, this 10% is going to be 20%. So percentage of the aged and the elderly is only going to increase. And I think by 2067, around that time, the population will start aging in this true sense, and we're going to have like what countries in the West are facing. India will start facing that problem. So we need to prepare ourselves for this eventuality. extended health lifespans, and people who will be able to live longer. And of course, as you live longer, at some point of time or the other, however healthy you may be, some issues will crop up, diseases will come, chronic illnesses will eventually be part of your life. And how we take care of that, how efficiently we can look after our elders, that I think becomes a very key component of healthcare. And I think this facility that is being launched here is something that makes healthcare very, convenient to the people who are suffering, who are aged, who are the seniors. And I think that makes a big difference, because it makes, when we talk of ease of doing business, we should also think of how we can provide our customers and, not customers, I would say provide our people ease of getting things done, ease of coordinating things. There's so many issues which are connected. And I think in that aspect, this kind of an approach, which looks at it in a holistic way, I think it's not just treating a patient because they have some illness, some chronic disease, whatever, but also how we can, give that patient enough emotional support, enough, logistical support, so that as you grow older, you need more, these kind of support systems. And having someone who is a like a points person who will coordinate things for you, who will see that things are being done, or who's monitoring things for you, depending upon the person's disease. Just now, as you said, there's so many various, stages. Some are very fit, some are in between, some are critical. So each person has to be looked at in a different way. Some will require, probably even regular daily monitoring, even though they may be in their houses. So how do you take that healthcare to their house, to their, once they're a patient, doesn't mean that once they leave the hospital, they are not out of your hands. I think when they're in their houses also, they're still in your hands. So you need to look after that, and keep the best available treatments going for them, and also wellness. I think that is a component which will be included. So how do you make them more healthy, and how do you make them more, emotionally and physically more, to be more capable, to be able to do things better, and to be able to lead ultimately what is the end game? To lead a more fulfilling life. Because as you grow older, what becomes more important is how much you can enjoy the life that you live. Whether you can be mobile, whether you can be traveling, whether you can be, fully involved in things, working, writing, whatever you're doing. How long can you continue to do that? Even though you have an illness, how can you lead as normal life as possible? So that's, if you can do that, then you enjoy your life. And you can enjoy being alive. So it's not just, I think, being able to live long, but to be able to live healthily. So to be able to lead an active life. So that I think becomes important. And as we have an aging population and smaller families, and with nuclear families, or children not being here, children being abroad, children working in some other city, in some other state. So you should be able to take care of yourself, to be able to be independent. And for that, I think, one is, of course, physically fit, fine, but when you're not well, then I think that support becomes even more important. And for people who've got family support, such a program I think is wonderful for them, because they may be anywhere else, but they can look after their parents or their elders. And so this, curated, I would say it's a curated program that is being started here. And I'm sure this will really will give it a focus. I think what happens when you do these kind of things, it brings in focus into all aspects of healthcare and how we can improve a person's, how the person is living, how we can make him more comfortable. And I think that is really wonderful with all the various aspects of this program, dedicated helpline, concierge team, then supporting 24/7, coordination, assistance, everything has been made part. And I'm sure once this starts being implemented, it can only improve and more things as you do, you learn and you can further improve it. So I think it's something which is essential and will become part of every hospital, I suppose, and every healthcare program, even in government. We have to start thinking of how we can take care of our elder population, because eventually we will be like the Western countries, and if we don't start early, we will suddenly wake up and see that we don't have the infrastructure, or we don't have the facilities, or we don't have the policies to look after them. So we are also looking at it very deeply as a government, how we can help our people as they age, and how we can give them as good a life as possible. So without taking any more time, I would want to congratulate Apollo. They are continuing in furthering healthcare in this country, and I'm sure that it is only going to grow further. And any support that Apollo needs from us, we are always there. Our doors are open. And we are there to work ultimately, private, public, and semi, whatever, we all have to work together so that our society benefits. And saying these few words, I want to thank you once again. Thank you very much.
And the members of the Apollo family, and more than anything else, the members of the media, I'd like to acknowledge your presence. For 41 years, the people who really worked with us, helped us in our journey of progress has been the media. And I'd like to thank you and acknowledge your presence for being with us. I appreciate the fact that the Honorable Minister is here with us. Sir, your presence really validates the fact that there is so much more to do in healthcare, and we cannot be complacent in what we do, and we have to continue to serve humanity. As a proud Indian, I would also say that it's people like you who put us on the global map, because you push the private sector to do more, and I think that is a role which we enjoy, because unless the leaders tell us what has to be done, sometimes we just do our own thing. So sir, your presence here really helps, and I think your timing was just perfect. It was like good shopping for us. So thank you for being there.